You're listening to localwebradio.fm.
Welcome to the Healthy Smiles Oral Health Show with Dr. Norm Ickert, brought to you by Ickert Dental Implant Centre, where they are committed to providing you with the very best in modern and advanced dentistry. Now, here's your host.
Hello, this is Nick Jaworski, and I am your host today, and I am here, as always, with Dr. Norm Ickert, Director of Ickert Dental Implant Centre, and today we'll be talking about the overall success rate for dental implants. Now, before Dr. Ickert joins us, just a reminder that if you have questions or require any sort of assistance, you can call Dr. Ickert's office at 604-881-1381. That's 604-881-1381. Dr. Ickert, it's great to be talking with you.
Nice to be here, Nick. Thank you.
Okay, so in the last session, we talked about that sort of preliminary examination that you would undertake with a patient when they show up at your office. And now we're going to talk about the dental implants themselves, their success rate, things we should know. So let's just start with the big question. What is the overall success rate for a dental implant?
Well, Nick, this is actually a fairly loaded question, and hopefully we can break it down a little bit so it makes some sense. But in general, if you look at the literature, the statistics for implant survival is in the range of the mid-90s. In other words, 95% or higher. So that's a very, very high number when you work with anything in the so-called medical field.
Yeah.
But we have to realize it's not perfect. And there is a difference between survival of an implant versus the success of an implant. Sometimes implants can still be in your mouth, but there could be problems either with some bone loss, or there could be some other issues such as food getting trapped or other concerns. So we want to be really careful not to get too cocky about this. But what we're really trying to say is that if we take the time to do a proper diagnosis, and if we use the proper implants, and if we execute the treatment plan in a proper manner, and most importantly, if our patients are compliant with our instructions to look after themselves during the time of the treatment, if all these things are done well and we're dealing with a healthy patient, implant success rate is extremely high. Now, having said that, of course, we can never predict 100%, just like a surgeon who does a hip implant or a knee replacement might say to you, this has a great success rate, but it is possible that the body could potentially have a bit of a foreign body reaction. I mean, that is possible, but I have to tell you, it's extremely rare.
Well, that's very encouraging to know, and I'm sure that modern science, I'm always talking about the development of these treatments. To have a number that high is really encouraging to know that there's most likely an option for a patient to get their problem fixed.
It's so true, because today we're almost at the point that if the patient has the will, the desire, and the resources to go through with this treatment, almost any situation that they present with, assuming that they're relatively healthy, can be improved upon with the use of dental implants. It really is a complete game changer and deal breaker in terms of the difference it has made for our patients that used to have to suffer with their dentures or their missing teeth or with the impact of trauma. Like, we have such a wonderful opportunity today. And it's not just the implant, it's the ability to regenerate bone, to regenerate soft tissue, and to have the amazing lab support. And with all the new technology, with materials, it's a very exciting time today to be in this field. And even with the computerized technology where we can mill so many of these restorations today, it's just wonderful of the options that do exist today for our patients.
Now, real quick, you went through a list of key ingredients to making sure that, or to help the case for a successful implant. It was proper diagnosis, the proper implant execution, patient compliance. We talk a little bit about that patient compliance element. What are the kinds of things that patients are being asked to do to make sure that they have the best chance for success?
I'm actually really glad that you brought that up, Nick, because one of the challenges that we deal with today in our society is that you know how everybody is so busy. It doesn't matter what age you are at.
Mm-hmm.
Everyone is so busy and no one likes to really miss a day of anything or miss work or miss a function. And that really becomes a bit of an issue because you see, at the end of the day, it's still surgery. And it still has to go, the body still has to go through the normal process of healing and all the factors that have to play into that in order for the healing to go well. Now, we have incredibly changed the need for long-term times of rest or so because the techniques have gotten so much more non-invasive,
right,
or at least minimally invasive. But the fact is, when you drill a hole into a piece of bone or you drill a hole through some gum tissue, it still has to heal. And so in order for it to heal, you have to have a blood clot. All healing starts with a blood clot. And if you disturb that blood clot, you will always disturb the healing process. So whether you disturb the blood clot through smoking or whether you disturb it through excessive activity, even going swimming or going for a run that is too hard on the heart rate or so, it will disturb the blood clot and it'll just delay the healing. I mean, you will eventually heal, but it's just going to delay the healing. So depending on the nature of the surgery, we really try to encourage our patients to organize their surgery date to a time when they don't have to be out in the yard next day, or they don't have to be vacuuming, or they don't have to, run a marathon or a triathlon or whatever they do. It's just important. Now, of course, some procedures are very straightforward. So a single implant into a healed site, it's almost like the patient doesn't know anything was done. But if we're doing a bone grafting procedure or a sinus grafting procedure, it's really important that our patients understand their responsibility to take it easy for anywhere from 3 to 5 days to allow things to heal. And then after that, we introduce new instructions in terms of eating softer foods and being very careful with your hygiene and those kind of things, which can have a huge impact on the overall healing.
You know, it's interesting. I assumed that when I asked that question that it was going to be a lot about the foods that you ate and sort of manual touching of sites and things and brushing and that kind of stuff. But really, you're saying that a big problem is that people just don't stop to rest to let their body do the work.
Exactly. And the things that you did mention are very important. However, we like to tell our patients, especially after doing more invasive surgeries, that the less they do, the better. Less is more. In other words, the body is so magnificently designed that if it experiences trauma, it wants to heal itself. And sometimes by us trying to be too concerned with going in there with saltwater rinses and all those things, it can actually disturb the healing of the early wound healing. Now, of course, once the wound has healed, we are very adamant about proper maintenance protocols and proper hygiene and proper products that we recommend. But initially, for the first 5 to 7 days, less is more.
That's really fascinating. And actually, we're going to take a quick break. When we come back, we're going to talk a little bit about what happens if an implant fails and sort of to go from there. Low chance of that happening, but sometimes it does. And we should talk about that. So don't go anywhere. We will be right back.
More Healthy Smiles with Dr. Norm Ickert from Ickert Dental Implant Centre after this.
If you've been known to enjoy a nice glass of wine, be sure to tune in to From the Vine to the Wine with Matt Berzovich on the Lifestyle Channel on localwebradio.fm. If soccer is a part of your life on the Semiahmoo Peninsula, be sure to tune in to This is Soccer with Chris Murphy, Executive Director for Coastal FC on the Community Channel on localwebradio.fm.
Would you like to get more from the devices you own? Not quite sure where to start? There is help. Catch Powering Up for Non-Techies with Justin Martell, Computer Department Manager at London Drugs, on the Specialty Channel on localwebradio.fm.
It's time now for more Healthy Smiles with Dr. Norm Ickert.
All right, and we are back, and I'm still here with Dr. Norm Ickert. And we're talking about that first meeting, those first steps in the dental implant process and what to expect. And so, Dr. Ickert, I know the chances are low. I know the risks are very low. We've got a 95% success rate with an implant, but sometimes things don't go the way we want them to go. And what happens when an implant fails?
Again, Nick, it depends on the specific situation. And when I mentioned the 95% rate, I'm talking about a healthy patient that doesn't have any gum disease, is not a smoker, and all those other factors that, are a part of having a better success rate. If we do an implant on a smoker, or if we do an implant on a patient who has, let's say, significant periodontal disease, there's going to be a higher chance of failure for sure. So every case has to be taken on its own merits. But what we do know is that our experience has been that when an implant does fail and we clean the site out and remove the implant and we place a new implant, there's almost a 95% chance or higher that that implant will be highly successful. So just because an implant fails doesn't mean that the treatment is over. Like we can generally replace that implant with no problems whatsoever.
Well, that's encouraging.
It really is. It's interesting as the new literature is becoming more apparent to us, as much as even just a few months ago now. I've heard a couple of amazing lectures in different parts of the world, and they're published now, is that even situations such as the death in the family or increased stress at work or just some type of change in the load or stress in the mouth or other things can cause a change in the foreign body response of your body towards the implant. And so my point is that if we have a protocol where we can see our patients and maintain them on a regular basis, we can usually pick up on these things and we can take measures to try to help an implant which otherwise might undergo some issues. We could maybe help guide this implant through that process and allow it to survive long term without any problems. So the maintenance is really, really the most important part of the implant therapy to ensure that it survives long term.
Now, I didn't think to ask this before, and I probably should have, but how do we find out that an implant is failing? Like, what are the symptoms for that? Is that something that becomes uncovered during a repeat visit to you to check up on it, or is that something that I might notice at home?
That's an excellent question, Nick, and it's a bit of both. If the implant is failing slowly, most often the patient doesn't even know about it. And so that is always the reason why we'd like to see our patients back on a regular basis, where we can actually look in the mouth, we can take an x-ray, and that will usually tell us if there's bone loss around the implant. And from there, we can take the necessary corrective action. So quite often, the patient will not recognize that the implant is failing. In some cases, if bone loss is fairly significant, it will also mean that there will be some soft tissue or gum loss, and that can actually lead to discomfort upon cleaning or just normal functioning. And so some patients do feel that something doesn't feel quite right, and usually it's some kind of inflammation of the gum tissue around the implant, which tips us off that something is not quite the way it should be.
And this goes back to this discussion of proper patient compliance. The going back and making sure you schedule those appointments to be looked at is very important.
Yeah, and I have to be honest with you. Initially, when we first started doing implants, we were so enthralled and excited about the implant procedure itself that we did not pay as much attention to the maintenance aspect as we should have. But as we are doing these implants on such a high volume of, well over, we're doing hundreds and hundreds every year, it gives you a great database to see how implants actually respond. And there is no question that implants that are well maintained, both by the patient at home as well as by the hygienist in the office, do far better than implants that aren't maintained. Now, at the end of the day, it still comes down to the patient's own host response. And there are patients who don't clean their teeth and never get a cavity. And there's other patients who clean their teeth twice, three times a day and still get cavities. And it's not their fault. It's just everybody's host response is different. But with implants, it's even that much more important, because with natural teeth, we have a periodontal ligament, which acts like a defense mechanism for our teeth. But we don't have that with an implant. That implant is just a piece of titanium sitting up against a wall of bone, and we depend on the patient's foreign body response to try and make that a happy marriage for the rest of the patient's life. So if we can avoid any kind of unnecessary inflammation or bleeding around that site, then that will go a long ways in terms of making that implant last a long time.
That's great. Now, we're almost out of time, but do you have any closing comments or thoughts about, success rate, failure, or anything about that initial introductory appointment related to dental implants?
In my opinion, Nick, the introductory appointment should be an opportunity for the patient to receive information without any obligation whatsoever. Just to be able to get a sense for what an implant is this an appropriate treatment solution in this particular situation, and basically have the dentist do what I call a risk assessment, where we do a diagnosis, we establish a prognosis or an expected outcome, and we have a treatment plan along with options, because there are several different options available. And I think it's really important that the risks are discussed, the rationale is discussed, and the benefits are discussed. So the patient really does have a thorough understanding of the value of entertaining this type of procedure. Because now you have a framework from which you can make an informed decision that will provide the type of service that will provide the function, the aesthetics, and the overall satisfaction that implants can provide for our patients today.
Well, thanks for that, and that is a great place to stop. We got a full picture of how we should approach this whole process, and that includes this podcast and the previous ones. I feel like I'm very informed about what's happening, and if you, the listener, know somebody who would benefit from all of this, make sure that you share the podcast with them. I mean, all the episodes, some great information going on there. And you can always reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. And you can reach him by telephone at 604-881-1381 or toll free 1-866-931-1981. Dr. Ickert, as always, thanks so much.
Thank you very much, Nick. I look forward to meeting with you again.
Thanks for listening. At Ickert Dental Implant Center, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.
This episode is a production of Jam Media. For information on hosting your own web radio show, visit jammedia.com. That's www.jambmedia.com.
The opinions expressed by our guest and host on localwebradio.fm do not necessarily reflect the views of Jam Media or its owners. No expressed or implied opinions of any product or service should be considered an endorsement or recommendation of any kind by Jam Media or its owners.